hospitals across the state say they may have to close or reduce service if lawmakers don't act.
Yeah, so there's proposed legislation that would drastically cut payments to hospitals for services performed in off-site campuses. That would include removing nurses from many Indiana schools. News 8's Richard Essex is in the State House tonight with that story. Richard.
Well, many Indiana schools use nurses that are contracted through local health care providers, and this legislation seeks to cancel those private contracts. And there are some Indiana lawmakers that want to force health care providers to reduce their costs by offering what is called a location prices, essentially forcing hospitals to charge by where the procedure was performed. Lawrence Township Schools has a contract with Community Health to provide nurses and athletic trainers. The school uses a separate provider for mental health services.
There were over 900,000 visits to a school nurse in our school district in 2019. And think about taking that away. And for some kids, it might be the only health care that they get.
According to the Indiana Hospital Association, more than 200,000 Indiana students are cared for daily by a school nurse, whose services are contracted from an outside health care company.
You know, 1 out of every 8 kids in the state of Indiana is seen by a nurse every single day.
The proposed legislation would, according to Dr. Yelty, wipe out those agreements. Some Indiana lawmakers want health care costs discounted for services that are provided away from a main hospital, citing a lower overhead at clinics and outpatient facilities.
Healthcare experts know that a chemotherapy patient should not be sitting in a lab waiting room waiting for a routine blood draw next to a patient with a respiratory illness.
However, Dr. Yelty says that this would essentially end the healthcare expansion into rural Indiana counties.
So right now, we're kind of spread to where the patients are. With this legislation, we have to consolidate to where the hospitals are. So it's going to affect a significant number of our patients.
The Senate did vote this afternoon to remove the language that would require the location costs and the removal of private contracts. But we are still about 2 weeks out from this session ending, so anything could change between now and the end of session. In the State House, Richard Essex, Wish TV, News 8.